The first is the number of those lipoproteins. So the more of those low-density lipoproteins you have, the greater your risk of this happening.
The more of those you have, the greater the risk.
That's right. The more of, you can think of it as kind of like a random process. So, you know, the more cars going down the road, the more chance that one of the cars is going to bump into a curb.
Sure.
Okay, so fewer cars on the road is better for everybody.
So how do we minimize the cars?
So there are some dietary ways to do it, and there are some pharmacologic ways to do it. And you know, how much of each you need depends on the situation you're in. But the reality of it is, if you really wanted to prevent heart disease, you know, it's funny. I think almost everybody would benefit from lipid-lowering drugs to take that lipoprotein down as far as possible. And I'll explain why in a moment. I'll come back to it. The second thing that drives cardiovascular disease is blood pressure. So elevated blood pressure causes a mechanical stress on those artery walls, and it makes them more susceptible to those little lipoproteins going in. So you can think of it like the integrity of the wall is what keeps those lipoproteins out. If you damage the integrity of that wall, more and more of them get in. And the third thing is smoking.
And that's blood pressure.
Yes, high blood pressure. The higher your blood pressure, the more stress you're putting on that wall, the more shear stress.
And how do you decrease blood pressure? What's the efficient ways to do that?
I mean, weight loss is an enormously efficient way to do it. Exercise is an important way to do it. In some people, sodium reduction matters if their kidney function isn't perfect.
Okay.
And if all else fails, I mean, sleeping adequately does it. So correcting things like obstructive sleep apnea can help. And ultimately, pharmacology helps if none of those other things work. And then the third one is smoking. Yeah, so smoking is an enormous driver of cardiovascular disease, and it has a chemical irritant on that same thing. So smoking sort of chemically irritates the artery wall. So basically all roads to cardiovascular disease have to do with the integrity of the artery wall and the ability of the lipoproteins to get in and do their damage.